Member's time has expired. I call the honourable member for Ryan.
Thank you, Mr Deputy Speaker. I had to laugh earlier today when the Leader of the Opposition delivered a press conference moaning about the health portfolio while he stood in front of a wall of pain medication. I don't know about the rest of you, but when I hear any of those opposite continuously whining about the government's health policies while offering no alternatives, pain relief would not go astray. Mr Deputy Speaker, when it comes to Labor frivolously flouting their unfounded presumptions about health policies and how Australia can sustainably afford growing costs, their ideas, or more accurately lack thereof, are about as effective as trying to solve an algebra question by chewing bubblegum. Like the delinquent child in the classroom, their erroneous and disruptive comments get in the way of real solutions and real action. They may as well put down their pens, stop doodling, stop shooting spitballs at the teacher, take the kick me signs off their colleagues' backs and listen to the adults in the room. The coalition government is the only party offering a realistic plan for a sustainable health system. Mr Deputy Speaker, I see in today's MPI the opposition is accusing the government of hurting Australians by increasing cost to health. Well, Mr Deputy Speaker, those opposite must be experiencing chronically fluctuating episodes of awareness to have forgotten their own record in the health portfolio and how much they have hurt Australians. After experiencing some kind of election-induced amnesia, the Labor government broke their promise to Australia on private health insurance. They repeatedly promised to our faces they would not change the private health insurance rebate, yet behind the backs of all Australians, they made repeated attempts to undermine private health insurance and increase the costs for the 11 million Australians on private health insurance. The amnesiacs opposite seem to have forgotten that while in government, they jeopardised the listing of new medicines on the PBS. The Labor government delayed the medications for patients suffering from schizophrenia, chronic disabling pain, lung disease and many other conditions for months. The Coalition has delivered on our commitment to restore the independence of the pharmaceutical listing process. In fact, we have gone even further. The independence of the PBAC has been restored and its recommendations will not be ignored. We have listed or extended the listings of 221 medicines, twice as fast as the previous Labor government. That's right, Mr Deputy Speaker, helping Australians, not hurting them. Those opposite obviously prefer to remain in a euphoric state of denial, conveniently forgetting the billions of dollars, Australian taxpayers' dollars, that they wasted en masse while in government. Labor, after promising to build 64 GP superclinics costing $650 million, only managed to build half, the rest remaining open paddocks. Labor's Australian National Preventative Health Agency wasted $463,000 to fund a study into the fat tax on junk food, despite both major parties all ruling out this option. They also spent $236,000 on a fake music festival. Just think, Mr Deputy Speaker, if those opposite had not wasted billions of dollars on failed policies, thought of on the back of drink coasters in an effort to gain publicity, we would not be in the situation we are now, losing $1,000 million a month. That equates to 4 new hospitals a year in interest repayments alone. Not fixing the debt, just in interest repayments. Those opposite must be living in a parallel universe if they think that they have a strong record when it comes to health. Labor promised to slash elective surgery waiting lists, yet under their watch the average national waiting time for elective surgery increased. Labor attempted to tear $400 million from medical research in 2011, then they ruthlessly ripped $140 million out of medical research before the election, hiding it in budget jargon. Mr Deputy Speaker, Labor allowed health bureaucracy to balloon while frontline services, private health insurance and other areas face cuts. Labor created more than 10 new health bureaucracies while in government. They preferred to fund bureaucrats and consultants rather than doctors and nurses. Mr Deputy Speaker, those opposite need to stop with their floridly psychotic behaviour. They need to stop hoping their nonsensical delusions will somehow fix the legacy of debt and deficit left behind after their chaotic circus of a government. Leaving our children, grandchildren and future generations to pick up the tab is not a responsible option. Labor's complaints are chronic, however their constructive solutions are mythical. Mr Deputy Speaker, it is clear that when it comes to health and repairing the budget, only the Coalition can be trusted. Only the Coalition can actually help Australians.
Order. I call the